Hi, everybody. Welcome back to week 5. So, over the next 4 weeks, we are going to explore and dive into some additional and key brief therapies. We've already reviewed narrative therapy and solution-focused brief therapy. This week, we're going to talk about motivational interviewing and cognitive therapy. So, motivational interviewing, or MI, as it's also known, is widely used and effective treatment modality for various mental health conditions, but especially for substance use disorders. At its core, MI believes that clients' potential for change lies within their personal experiences, and that increasing a client's motivation to change will increase the likelihood of successful treatment and symptom improvement. It's the therapist's responsibility to create an atmosphere of collaboration, compassion, and acceptance surrounding the client's internal motivation to change. But MI utilizes effective and important interviewing skills in the hopes of bringing about the client's intrinsic motivation for behavioral change. This requires a truly collaborative approach, where the therapist is really meeting the client where they are and conveying acceptance of the client's current situations. A lot of times this means, quote unquote, rolling with the resistance, especially for clients who present with that factor. Compassion is another equally important attribute of MI. As therapists, I feel we're all pretty compassionate and truly care about our clients. But when utilizing MI, you want to ensure you're showing compassion for where they're at in their life and where they've been. You want the client to feel seen and heard, and that you're showing you have their best interest in mind. And lastly, MI therapists believe within all clients exists some capability and motivation to change. They believe the client fully encompasses the ability to be their own change agent and uses MI techniques to guide the client in the process of identifying strengths and resources to facilitate the behavior change. There are 4 processes that therapists move clients through when facilitating MI. These 4 are engaging, focusing, evoking, and planning. Engaging is the process of building a strong therapeutic reliance with the client. Focusing refers to the process of establishing the direction of sessions by prioritizing behavior change targets. This is because a lot of times clients can present with multiple areas of concern that can require significant attention. Next is evoking, which is the process of change talk after you've established engagement and focus. When we say change talk, we're referring to anything in the client's speech that favors change. It's a skill that you can develop to listen and recognize change talk. So some examples of change talk would be when a client says, "I wish I could stop drinking," or "If I stopped using drugs, I could hold down a job," or "I don't know, I might be able to stop lashing out." The last process is planning. Planning is defined as a process of negotiation and collaboration, drawing on the patient's expertise as well as your own. So there are some core skills to put into place to help guide clients through these 4 processes. There are a few that are very specific and pertinent to MI. The acronym for them is OARS. This stands for open-ended questions, affirming statements, reflective listening, and summarizing. These are great skills to have in place during the engaging process in particular. Here's some examples of OARS. So an open-ended question looks something like, what worked for you in the past? So not a yes or, they can't answer with a yes or no. They have to expand. An affirming statement looks like, it sounds like you displayed a lot of perseverance by pushing through that difficult time. An example of a reflective statement is, I hear you say you're considering doing things differently. And a summarizing statement is something like, last week you mentioned you wanted to stop drinking because it gets in the way of your relationship with your daughter. You mentioned that you think you're ready to change your drinking habits. There are other very useful techniques talked about in your textbook, so make sure to read over that chapter, especially if you're in the group presenting on MI. All right, next we'll move on to cognitive therapy or cognitive behavioral therapy. So cognitive behavioral therapy, or CBT, is a highly studied, highly effective form of brief psychotherapy for many different psychiatric and medical disorders. It's a brief therapy modality that translates really well to various settings. So you find it used in inpatient facilities, outpatient care, schools, crisis centers, you name it. CBT, it's time sensitive, structured, and bases its theory of psychotherapy on clients' views of themselves and their environment as being central to how they feel and act. The origins of CBT led to the cognitive triangle. I'm sure you all have probably seen some version of this before, but you can see in the picture what encompasses the cognitive triangle. One's thoughts influences their feelings, which influences their actions. Sometimes people like to extend an extra line from actions to reflect consequences, so one can see how their actions brings about various consequences. So part of understanding and addressing the maladaptive patterns with CBT is understanding the core beliefs that bring about automatic thoughts that we have. The cognitive model helps one recognize the themes in their thinking and how they came about. Here's an example of what it could look like for someone and how you could walk a client through understanding their actions. So in this example, the initial situation could be the opportunity to ask someone out on a date. Past experiences with that showed the client that when you ask someone out on a date, they laughed. So some of their core beliefs were created around themselves and the world, including, I'm not lovable. People are just cruel. The world is a lonely place. If someone asks me out, I'll just be rejected. An automatic thought based on these beliefs could be, I'm ugly and people don't like me. I'm going to end up alone. And because of that thought, the client feels sad or anxious around people they find attractive. Because of that, they avoid other people and don't ask anyone out. So you can kind of see how that cognitive model works. In CBT, the goal is to help clients view their reality and themselves more clearly through examining their cognitive distortions. In theory, this will lead to improvements in the client's mood and functioning. So some techniques used in CBT to work through therapeutic goals include problem solving, graded task assignments, activity monitoring and scheduling, psychoeducation, giving credit, guided discovery, thought record, behavioral experiments, responding to patients' valid thoughts, weighing advantages and disadvantages, coping cards, imagery work, graded exposure, response prevention, and modification of underlying beliefs. As you can see, there are a lot of techniques used in CBT, and we could honestly spend another hour breaking them all down, but I recommend looking more closely at the specific techniques in your textbook. The great thing about CBT is that these techniques can be used really well with many different age ranges. So young kids and adolescents, these techniques work really well for them. All right. Thank you for being with me today, and I will see you all next week. Take care.